Obstetric fistula, as a result of complications during labor, is affecting a number of women, mainly those below the age of 20. This is because of the undeveloped body of the teenagers. However, women who give birth frequently or sexually abused are also likely to suffer from obstetric fistula. Available information indicates that about 1,900 new cases of fistula are registered annually, with an estimated 200,000 believed to be suffering from this condition in Uganda.
We know from observations, research, observations from the past, for most of our health conditions, when you see one coming to in the healthcare setting, there are 3 more that are still out there in the community.
Women and young girls who suffer obstetric fistula experience continuous and uncontrollable leakage of urine and feces due to lack of treatment, resulting into an offensive smell. Treating obstetric fistula depends on the severity of the condition. In severe cases, corrective surgery is performed to provide effective treatment for women suffering from obstetric fistula by a skilled surgeon.
And I've been able to carry out operations here, which probably, reconstructing the birth canal, for instance. We may not have done many of those as our surgeons here in Uganda, but our colleagues from outside were able to do it.
I've been able to get very good experience in looking into the bladder using the machine called cystoscopy, where you can be able to look into the bladder and see what problem is in the bladder. If there is a fistula, that is a hole in the bladder, you can be able to see.
However, the challenge of this condition is that it's still rampant in the society, with many mothers suffering silently, coupled with poor awareness of where and when to seek care when faced with a difficult delivery. Senior fistula surgeons in Uganda recently held a surgical skills sharing training comprising of fistula experts from Germany, Ethiopia, and Uganda on how to manage obstetric fistula at Terewonde Women's Community Hospital in Soroti.
There is a need of surgical skills and how to have a change of information and really work together on a patient to get the best output.
At the Reintegration Center in Soroti, survivors are enrolled for intensive training for the campaign against fistula and economic skills to allow them earn a daily income away from domestic violence. There is also need to equip the center with various elements of specialty to treat complex medical conditions and to provide continuum of clinical care for the spectrum of ailments sustained. Currently, the country has a limited number of senior surgeons to provide fistula-related complications among affected mothers. At least 2,000 mothers are assisted annually and reintegrated back into their communities. Mutonyi Hilda, UBC.